Bismillahirrahmanirrahim. Assalamu alaikum. আমরা এখন রিভিউ অফ প্যারাসাইটোলজি সংক্ষেপে এটা আলোচনা করব ইনশাআল্লাহ। প্যারাসাইটোলজি আমাদের দেশে প্যারাসাইটিক ডিজিজ এখনো হয়, কিন্তু প্যারাসাইটোলজি প্যারাসাইটিক অনেক আগের চেয়ে অনেক কম, মানুষের হাইজিন এবং অন্যান্য জিনিস ভালো হওয়াতে। তো পরীক্ষার আগে যে জিনিসগুলো সবসময় মনে রাখতে হয় সে সমস্ত কিছু জিনিস নিয়ে আজকে রিভিউ ক্লাস। তো তার আগে শুরুতেই যদি প্যারাসাইট is also one of the microbial disease, just a few slides, 2 slides about principle of lab diagnosis of any microbial disease. You know, demonstration of the causative agent by microscopy and commonly practiced for parasitic as well as fungal disease. Culture, that is isolation identification, commonly practiced for bacterial disease. Detection of antibody or antigen, practiced for both viral, bacterial and many parasitic diseases. Detection of nucleic acid is modern method. And the steps involved, you all know, you need a specific, according to site of infection, a specimen, then microscopy, culture in specific cases, immunological test, and PCR test. So let us start with a formula for lab diagnosis of parasitic diseases. Based on my teaching experience, we developed this formula. We have found that almost all parasitic diseases can be diagnosed by microscopic examination of appropriate specimen and finding some structure of the parasite, a specific structure of parasite. This is the formula. So formula is almost all parasitic diseases can be diagnosed by microscopy of appropriate specimen. So appropriate specimen, that depends on the site of infection. That can be blood in case of malaria, in case of diarrhea or dysentery, stool, can be bone marrow, etc. And what are the protozoal structures? Protozoal structures include cyst, trophozoite, and a special structure like oocyst, LD body, cygon, etc. What are the metazoal structures? Metazoal structures include ova, larva, and segments. What is the role of immunological test in laboratory diagnosis of parasitic diseases? Immunological tests nowadays very popular because they are simple, sensitive, and specific, and skilled personnel not required, and there is very less or no subjective variation. Some examples of immunological tests used for diagnosis of parasitic diseases. Kalajor, yes, ICT for Kalajor using RK39 is very sensitive and specific. Malaria, there is ICT for malaria both for antigen, antibody, and Plasmodium falciparum ibex can be differentiated. For filaria also, there are ICT, filarial antigen for classical filariasis and antibody for occult filariasis. Hepatic amoebiasis can be diagnosed by antibody against Entamoeba giardiasis, can be diagnosed by antigen detection. Cryptosporidium by direct fluorescent test, hydatid disease by Cassonid test, and hemagglutination test for antibody. Now let us examine the laboratory diagnosis of parasitic disease by microscopy. As we have said, almost all, virtually all parasitic diseases can be diagnosed by microscopy. Let us see the example. Say amoebiasis. Intestinal amoebiasis diagnosed by microscopy or stool, and you can get either cyst in case of chronic cases and trophozoite in acute cases or loose stool. And for hepatic amebiasis, liver aspirate for trophozoite. Another example, common disease giardiasis can be diagnosed by microscopy of stool for cyst or trophozoite. Trichomoniasis, a STD, can be diagnosed by simple microscopy of vaginal discharge and finding the trophozoite. Malaria can be diagnosed by microscopy of peripheral blood for malarial parasite that includes Seijon, merozoite, or gametocytes. Kalajor can also be diagnosed by microscopy of bone marrow, spleen, or lymph node and finding the LD bodies. Cryptosporidiasis, a little bit difficult to diagnose, but still can be diagnosed by microscopy of modified gel Jensen stain smear of stool and finding the oocyst. So we have seen all the protozoal diseases diagnosed by microscopy. Diagnosis of parasitic disease by other tests. Kalajor, besides microscopy, can be diagnosed by immunological test, and culture can also be done. Malaria, immunological as well as microscopy. Hydatid disease by immunological test, filariasis by immunological test. So let us now discuss about the laboratory diagnosis of some important parasitic diseases present in our country. So laboratory diagnosis of Kalajor. In any laboratory diagnosis, it is better to have a principle of 2 to 3 labs. So principle is Kalajor can be diagnosed by demonstration of the parasite, that is LD body from the bone marrow, spleen, or lymph node aspirate, and by detection of antibody and antigen by immunological test. And the organism can also be cultured if facilities are available. PCR can also be done. Most widely used test is ICT for Kalajor using RK39. What are the steps? A specimen is very important here. You will have to take bone marrow, spleen, or lymph node aspirate, or serum for immunological test. Microscopy, Leishman stain smear shows the LT bodies, and you will have to examine at least 1,000 films before saying it is negative. Culture can be done, but not used for diagnosis. Serological test, there are specific serological tests for detection of antigen as well as antibody, mostly antibody, and ICT is very popular. Antigen can also be detected from urine. There are some non-specific tests like aldehyde test for detection of high globulin, but practically diagnosed by microscopy and immunological test. PCR is used for diagnosis of Kalajor as well as PKD. Laboratory diagnosis of malaria. Again, principle, malaria can be diagnosed by demonstration of the parasite, that is ring form, Seijon and gametocyte, etc. from the peripheral blood, and by detection of antigen or antibody by immunological test. So you will have to take blood, stain it with Leishman or Giemsa, both thick and thin films, to demonstrate the parasite, and species can also be identified by seeing the morphology. Culture rarely done, serological tests are popular, and PCR or real-time PCR and special type of LAMP PCR are also available for diagnosis, laboratory diagnosis of malaria. What is protozoa? And common 5 protozoa in Bangladesh. Protozoa means primitive, and the word protozoa is derived from proto means primitive and zoo means life, that is primitive life or first life in the world. Common protozoal disease in Bangladesh includes amebiasis, giardiasis, malaria, Kalajor, and trichomoniasis. We do not know the prevalence of toxoplasmosis. Rare protozoal diseases are sleeping sickness, Chagas disease, and cryptosporidiasis. Examples of laboratory diagnosis of helminthic disease by microscopy. As we have said, all parasitic diseases can be diagnosed by microscopy. So filariasis, you can diagnose by microscopy of peripheral blood for larva. You can see microfilaria. You can take the night blood, or you can take by giving some antimalarial drug and taking the blood after 30 minutes of that antimalarial. Intestinal helminths, almost all can be diagnosed by microscopy of stool for ova or larva. Enterobiasis, you need perianal swab, but microscopy is common. Because why perianal swab? Because these Enterobius vermicularis, they lay eggs outside the intestine in the perianal region. Tinea sedenata or solium can be diagnosed by microscopic stool, but segments or ova both can be found. And Tinea sedenata and solium, they cannot be differentiated by ova. They are differentiated by segments. Diphyllobothriasis can be diagnosed by microscopy of stool for ova and larva. Schistosomiasis, microscopy of urine or stool, depending on the type of the schistosomiasis. How many species of Plasmodium are there, and which species are found in our country? Plasmodium vivax, falciparum, ovale, malari, and there is another species, of which vivax and falciparum are found in Bangladesh. Which species of Plasmodium is most dangerous and why? Plasmodium falciparum is most dangerous because of 5 reasons. It infects both young and old RBC. Parasitemia is heavy. There is pernicious, that is abnormal manifestation. Cerebral malaria occurs, mortality is high, and frequently drug resistance, resistant to chloroquine and other antimalarial drugs. How anemia occurs in Kala-Jar? Anemia in Kala-Jar due to 3 mechanisms: bone marrow depression by infiltration of the parasite, hemolysis, and hypersplenism. What are the organs of motility for protozoa, and what are protozoa motile by pseudopodia, flagella, and cilia? Pseudopodia, Entaima histolytica, flagella, Giardia, Trichomonas, and Leishmania, and cilia by Balantrodium coli. Which are the infective form of following protozoa? Entaima histolytica, quadrinuclear cyst. Giardia lamblia, cyst. Trichomonas vaginalis, only one form, so trophozoites. Leishmania rhonopini, prognosticator. Plasmodium, sporozoites, toxoplasma. So this is a quotation from Barton Russell. No man can be a good teacher unless he has feelings of warm affection towards his pupils and a genuine desire to impart to them what he himself believes to be of value. সেজন্য একজন টিচারের শুধু পুঁথিগত বিদ্যা না, উচিত যেটা ভালো, সত্যিকারের ভালো, উনি যেটাকে নিজের জন্য ভালো মনে করেন সেটা ছাত্রদের মধ্যেও ছড়িয়ে দেওয়া উচিত। তার দর্শন, তার ফিলোসফি, এটাই হওয়া উচিত, এবং একজন টিচারকে স্টুডেন্টরা সেভাবেই ফলো করতে চায়। Which parasite is found within the RBC, which are found in macrophage, and which are found in the plasma? RBC, you all know, malarial parasite found within the RBC. You can see this. Leishmania donovini can see within the macrophage, and Trypanosoma brucei, cruzi, microphagia, they all are found in the plasma. They are large enough to be present in the cells. Common helminthic disease in Bangladesh. Nematodes are common in our country. Ascariasis commonest, followed by hookworm infection, enterobiasis, trichuriasis, and filariasis. Filariasis in northern part of the country. Nowadays it is rare. What are the infective forms of following illness? Ascarias lumbricoris, mature ova, hookworms, filariform larva, Strongyloid stercoralis, filariform larva, Enterobius vermicularis ova, Trichuris trichura ova, and Wuchereria bancrofti, 3rd stage larva. How can you diagnose Cryptosporidium in the laboratory? Whom it causes diarrhea. Cryptosporidium causes diarrhea, persistent diarrhea in immunocompromised patient, that is AIDS patient and any other immunocompromised. It can be diagnosed in the lab by modified acid fast staining where oocyst can be found can also be diagnosed by direct fluorescent test. Which cysts commonly found in the stool of child of Bangladesh? What is the difference in their pathogenesis and what is the character? Cysts of Entaima histolytica and Giardia lamblia are commonly found in the stool of a Bangladeshi child. Entaima histolytica causes lesion in large intestine and forms ulcer by invasion, and that's why stool contain pus cell, RBC, and cysts, or usually trophozoites of Entaima histolytica, and chronic cases cyst. Giardia lamblia causes lesion in the small intestine, and they do not invade, but by attachment with cup-like disc interferes with the absorption of fat. Stool contain fat cells, but no pus cell or RBC, and there is cyst of or trophozoite of Giardia lamblia. So, amoebiasis is an invasive form of diarrhea or dysentery, and Giardia lamblia is non-invasive form. Which parasites causes anemia and what type of anemia? Hookworm causes microcytic, hypochromic, and dimorphic anemia. Plasmodium causes hemolytic anemia. Leishmania donovani causes normocytic anemia. Diphyllobothrium latam causes megaloblastic anemia. Between Tinea saginata and Solium, which one is more dangerous and why? How can they differentiate them? What are the differences in their own? Tinea solium is dangerous than saginata because Cysticerca cellulose, the larval stage of Tinea solium, occurs in men. They can be differentiated by naked eye and microscopic examination of segments. Tinea saginata longer, solium broader. Rostellum hooks are present in solium, and there are differences in genital organs. There is no difference in the eggs. You can see this Tinea saginata and Tinea solium. Tinea solium with hooks, and Tinea saginata no hooks. Tinea solium is broader and saginata longer. Which helminthic infection occur following ingestion of meat, fish, and vegetable? If somebody eat improperly cooked beef, chance of Tinea saginata. Improperly cooked pork, chance of Tinea solium. From fish, Diphyllobothrium latam, and from raw vegetable, Entaima histolytica, Giardia, Ascaris, Lumbricoides, and Trichodis trichur. Which are vector-borne parasitic disease? Mosquito-borne malaria, filaria, sandfly-borne kalajor, sissy-fly-borne Trypanosoma brucei, and redovid bug Trypanosoma cruzi. Black fly causes Onchocerca volvulus ovulis in our country. Malaria, filaria, and kalajor are present, others are not present. What is the role of eosinophil and IgE in combating helminthic infestation? They help to expel the helminths by antibody-dependent cell-mediated cytotoxicity. Which parasitic infection occurs with fondling of the dogs? How and what type of host man is? Echinococcus granulosus infection or hydrated cyst by ingestion of eggs present in the dog's feces. Man is the accidental intermediate host and dog is the definitive host. They can be diagnosed by immunological tests like Cassoni's test, indirect hemagglutination test. Which nematodes have heart-lung migration? Following 4 nematodes have heart-lung migration. Ascaris lumbricoides, hookworms, that is Ankylostoma duodenale and Nicotor americana, Strongyloid stercularis. These 4 worms, they have heart-lung migration. That's why they also cause Loeffler's pneumonia. Which one is the commonest helminthic infection in Bangladesh, and what are the clinical problems with that? Commonest is ascariasis, and its problem is due to adult and larva. Due to adults, there are spoliative, mechanical, and toxic action. Speculative action includes protein energy malnutrition, vitamin A deficiency, that is night blindness. Due to mechanical action, there may be obstruction in the bile duct and intestine, and toxic action, typhoid-like fever, and sometimes rash can occur. Larva, due to larva, low flood syndrome, that is pneumonitis during migration of the larva in the lung. Which ova can be found in the stool of Bangladesh? These are the common ova: Ascaris lumbricoides, Ancylostoma duodenale, and Trichuris trichura. How can you differentiate between the Plasmodium vivax and falciparum? By morphology in the RBC and shape of gametocytes. You see, Plasmodium vivax is link form is larger, and falciparum link form is smaller. Plasmodium vivax present in one RBC, one parasite. In falciparum, in one RBC, many parasites, multiple infections. RBC size increases in Plasmodium vivax, but in falciparum it is a small, similar size. And gametes are important. Falciparum gamete are banana shaped, and vivax gamete are just round shaped. Which one is the infective form of Intra-Hemostotica and why? Trophozoites cannot cause infection. Infective form is quadrinucleate cyst because trophozoite cannot cause infection because they are destroyed by the gastric juice. What is the definitive and intermediate host? Where man is intermediate host. Definitive host is where the parasite passes adult life or sexual stage of life cycle, and intermediate host where larval form or asexual stage of multiplication takes place. Man is intermediate host in case of malaria and hydrated cyst. And man is both definitive and intermediate host in case of Tinea solium and Trichinella spirea. So this is all about the review of the parasitology. Thank you very much. Thank you for